Hi, I'm Cris Hicks, Director of the Imaging Department here at Salem Township Hospital. I'd like to talk to you today about osteoporosis and what you need to know to keep your bones healthy. Osteoporosis is a disease that affects 54 million Americans. This disease makes a person's bones weak and more likely to break. Since we can't feel our bones getting weak, you may have osteoporosis and not even know it. Fortunately, there are steps you can take to help prevent osteoporosis and broken bones. Take calcium and vitamin D daily. Do regular weight-bearing and muscle strengthening exercises. Don't smoke and limit your alcohol consumption. Talk to your healthcare provider about your risk, and if needed, take an osteoporosis medication that is right for you. So let's break these 5 steps down. Calcium and vitamin D. If you don't get enough of these in your current diet, you may need to take a supplement. Ask your healthcare provider or pharmacist if there could be any problems with taking a calcium supplement with the current meds or other supplements that you are taking. For instance, you should not take an iron supplement at the same time that you take a calcium supplement. Take your supplements with food whenever possible. And do not take all your calcium supplements at the same time. Your body absorbs calcium best in amounts of 600 milligrams or less, so divide it out throughout the day. Your body needs the vitamin D to help absorb the calcium, so when you're picking a supplement, make sure that it's a calcium supplement with vitamin D. So how much calcium and vitamin D do you need? Women age 19 to 49 need 1,000 milligrams of calcium and 400 to 800 international units of vitamin D. And women 50 years or older need 1,200 milligrams of calcium and 800 to 1,000 international units of vitamin D. Men age 19 to 49 need 1,000 milligrams of calcium and 400 to 800 international units of vitamin D. Men 50 to 70 need 1,000 milligrams of calcium and 800 to 1,000 international units of vitamin D. And men 71 years old and older need 1,200 milligrams of calcium and 800 to 1,000 international units of vitamin D. So exercise, weight-bearing exercise. These are exercises that work against gravity while you're standing. They're called weight-bearing exercises because your bones support the weight of your body. Some examples of this would be weightlifting, dancing, hiking, jogging, fast walking, aerobics. Anything that you could do while you're standing, those are weight-bearing exercises. Muscle strengthening exercises are activities that when you move your body, a weight, or some other resistance against gravity. Examples of these are weightlifting, using the elastic exercise bands, and weight machines. Limiting your alcohol consumption and not smoking are 2 things that will help prevent bone loss and osteoporosis. These things in excess contribute to bone loss. Your risk factors are older age, being a female. 80% of all diagnosed osteoporosis cases are female. Family history, small, thin frame, lifestyle, such as a diet that is not rich in calcium foods, excessive alcohol intake, smoking, lack of exercise, disease such as rheumatoid arthritis, diabetes, and eating disorders, and medications such as steroids and some cancer treatment therapies can also contribute to bone loss, which will cause osteoporosis. If you are at risk or have osteoporosis, talk to your healthcare provider, and if there's an osteoporosis medication that is right for you, they can get you on it. To find out if you have osteoporosis, your healthcare provider can order a bone density test or a Dexa scan. The National Osteoporosis Foundation recommends that Dexa scans are done of the hip and spine. Here at Salem Township Hospital, that's exactly what we do. If you are a woman that has neared menopause or a man that is 50 years or older, you need to find out your risk factors. And if you have these risk factors, you may need a Dexa scan. If you're a woman 65 years or older or a man 70 years or older and you've never had a Dexa scan, then you need one. Medicare pays for a Dexa scan once every 2 years. Here at Salem Township Hospital, we can take care of your osteoporosis needs. Call your healthcare provider for your order. Give us a call here in the imaging department at 618-548-3194, extension 8154. We'll get you set up, take care of your test, get the results back to your provider, and get you on your way to keeping your bones healthy. If you have any questions about anything that I've said today, or have more questions about the Dexa scan itself, feel free to reach out to me, Cris Hicks, the Director of Imaging. I can be reached at 618-548-3194, extension 8208. Thank you and have a great day.